Hi there, my name is Stein. I'm a second year student physical therapist at Regis University. I want to start off by introducing myself. I grew up in Oregon. I went to Oregon State University for my undergraduate, as well as I got a degree in kinesiology. A little bit more about me: I absolutely love to do anything outdoors, like camping, skiing, hiking, fishing, anything to kind of get me away from studying or work on the weekends. Um, Moving on, I think that in the acute and inpatient setting, one of my strengths is the ability to communicate or transition smoothly between diverse populations. During my last clinical experience, I got to work with pediatrics, geriatrics, amputee patients that are working to get fitted for prosthetics, as well as patients who had Ehlers-Danlos syndrome. So this combined with my experience as a hospital rehab technician, this has given me a strong foundation to be successful with your clinical system. Um, I think that when I enter a room to begin a therapy session, I prioritize building rapport and trust with the patient. I found that open communication is often an effective way to improve motivation and engagement. Incorporating meaningful functional tasks such as walking and to the bathroom or even walking down the hall or even in inpatient rehab trying to get them out to do their session in the foyer, something that allows them to feel more outside, get the breath of fresh air. This helps make therapy more enjoyable while still remaining goal oriented. So, as a part of a team-based care environment, one of my greatest strengths is dependability. I take a lot of pride in being reliable, on time, and I love to step in whenever and wherever help is needed. For example, if there's a peer that needs a max 2 assist or even a co-eval and treat for a new patient, I'm always willing to assist and ensure the patient care and workflow is not disrupted. Another strength that I bring to the clinical environment is patient advocacy. In my role as a rehabilitation technician, I prioritize patient safety during mobility and transfers. For example, during the COVID-19 pandemic, we had a lot of long-term patients that required daily therapy. And most of the patients would, as I saw them more frequently, they got more confident and they were asking for me to work with them, provide individual transfer needs, such as preferred techniques in the Hoyer lift to Saraseti. But this also helped make them feel more confident, but also the therapist that was attending feel more confident, and it just worked really smoothly. So, feedback. I value constructive feedback and actively seek it out during my clinical educations. In my first rotation, I communicated with my clinical instructor that I respond best to clear and direct feedback. I regularly asked for input after patient sessions, especially while charting, to understand what I did well and where I could improve. If I felt unsure about a skill or an interaction, I was honest and told them that, look, hey, I didn't do as well. Is there any way I can improve on this situation? This approach helps me reflect as well as stay motivated to continue to develop throughout my clinical experiences. So, to prepare for my upcoming CE3 and 4 rotation, I've been shadowing physical therapists in the acute inpatient setting. For example, I've already shadowed at the UC Health Anschutz in the neurotrauma and ICU, and I plan to continue to do that in order to stay uh, um, to get additional exposure and confidence in this environment. I also plan to review key coursework, including neuromanagement, as well as medically applied physiology, to reinforce my clinical reasoning and readiness for complex patient care. So, my goals after graduation, I plan to go straight into IPR as well as acute care setting with a focus in getting my NCS, like I already said, and my CCS. Another thing, a little bit about me, I would like to work in a hospital that would allow me to either join or start a clinical outreach program to raise awareness and provide health preventative measures for patients in the community that need it. So that's a little bit about me, what I like to do. I really appreciate you guys' time, and I look forward to hearing from you. So I hope you have a good rest of your day. Take care.